So question number 1, a client with a diagnosis of passive aggressive personality disorder is seen at the local mental health clinic. The common characteristics of a person with passive aggressive personality disorder. So this is the key point here. My patient is diagnosed of passive aggressive personality disorder. So which is the most common characteristics of passive aggressive personality disorder? The answer, superior intelligence. Number 2, underlying hostilities. And number 3, dependence on others. And number D, ability to share the feelings. The correct answer is B, underlying the hostilities. So why number B is a answer? The reason being, the client with passive aggressive personality disorder often has a underlying hostilities, and that is exhibited as a acting out behavior. And number A or C or D are not correct, although this individual might have a high IQ level, and it cannot be said that they have a superior intelligence. They also do not necessarily have a dependence on others or inability to share the feelings. So correct answer is underlying hostilities. Next question here. The client is admitted for evaluation of aggressive behavior and diagnosed with antisocial personality disorder. The key part of care of such client is, again, I want to tell you the key word is here, my patient diagnosed with a antisocial disorder. So the key part of the care, right? Number 1, setting realistic limit. Number B, encouraging the client to express their emotions or express for the behavior. Also minimizing the interaction with other client. And number D, encouraging the client to act out the feeling of rage. So correct answer is number 1, setting the realistic limit. So this is the answer we prefer. Why? So the client with the antisocial personality disorder must have a limit set on their behavior because they are artful in manipulating others. So we prefer number A. And the answer B is not correct because they do express the feelings, and number C or number D are incorrect because it is unnecessary to minimize the interaction with others or encouraging them to act out rage more than they already do. So what we learn from here? We learn antisocial personality disorder patient always need a setting realistic limit. Next question. An important intervention in monitoring the dietary compliance of a client with bulimia is. So the question about the eating disorder, bulimia. Number 1, allowing the client privacy during the mealtime. Number B, praising her for eating all her meal. Number C, observing her 1 or 2 hours after meal. And number D, encourage her to choose the food she likes and eat in moderation. So the correct answer about this question is number C, right? C is correct. So observing her for 1 to 2 hours after food. So you can see they willingly do vomit or not. So to prevent the client from inducing vomiting after eating, because bulimia patient, they eat, but they put their finger inside the mouth and they do the vomiting. So to prevent the client from inducing vomiting after eating, the client should be observed for 1 or 2 hours after meal. So allowing the privacy is started in, number answer A, will only give the client time to vomit. So if you give them privacy, they will induce vomiting. So it is not good for them, right? So then number D is not a correct. Encourage her to choose food she likes to eat moderate. Let me explain. So encouraging the client to choose the favorite food might increase the stress and chance to choosing food that are low in calorie and fat. So D is not correct. Next question. Assuming that all have achieved normal cognitive and emotional development, which of the following children is at the greatest risk for accident poisoning? So this question talking about the greatest risks of accidental poisoning. So which group more chance to accidental poisoning? So here, number A, 4 years old. Number B, number A, 6 month old. Number B, a 4 years old. Number C, a 12 years old. Number D, a 13 years old. Which age group more chance or under the risk of accidental poisoning? The correct answer is B, means 4 years old. Why 4 years old? The 4 years old is more prone to accidental poisoning because children at this age group are more mobile and curiosity, and they move here and there, and they want to eat everything. They want to put everything in their mouth, right? So answer number A, 6 month old, or number C, 12 years old, or number D, 13 years old are incorrect because 6 month old is still too small to be extremely mobile. 12 years old has begun to understanding the risks, and 13 years old is also aware about the injuries can occur and is less likely to become injuries than the 4 years old. So answer is number 4. And question number 5, which of the following examples represent the parallel play? Wonderful question. NCLEX board, due to some unknown reason, they like this type of questions. What does it mean, parallel play? So when we discuss the developmental milestone, we will talk about more. So number A, like Jenny and Tommy share the toy. Number B, Jamie play with his car beside Mary, who is playing with her doll. Number C, Kevin play a game of scrabbling with the Kitty and Sue. Number D, Mary plays with a handheld games while sitting with her mother lap. So parallel play. Two baby play side by side. They does not interact with each other. So correct answer is number B, right? So these two babies playing side by side with their own toy. They does not interact. So let me tell you, parallel play is play that is demonstrated by the two children playing side by side but not together. And the play, like Jamie and Tommy share the toy. And number C, Kevin play a game with these two others, right? So A and C particularly play because the children are playing together. It's not a parallel play. And number D, so the play, mother, the baby play with mother, right? Because the mother is not playing with the Mary also. So number B is the correct answer. And next question, the nurse is ready to begin an exam on 9-month-old infant. The child is sitting in his mother lap. Which should the nurse do first? So my client only is 9-month old, right? And you are the nurse for today going to exam. So what should the nurse do first? Number one, check the Babinski reflex. Number B, listen to the heart and lung sound. Number C, palpate the abdomen. Number D, check the tympanic membrane. So correct answer, listen the heart and lung sound, right? So at the beginning, I do this because if baby is irritated or disturbed, you will not get any added sound in the heart or lungs. Any wheezing or murmur we will not hear because if baby disturbed. So the first action that the nurse should take when beginning to examine the infant is to listen to the heart and lungs. If the nurse elicits the Babinski reflex or palpate the abdomen or looks in the child's ear first, the child will begin to cry and it will be difficult to obtain any objective findings while listening to the heart and lungs. So therefore, answer is number B. Next question here. Next question here. In terms of cognitive development, a 2 years old with expected. So 2 question, cognitive development, and my client is 2 years old. So would expected findings. Number A, think abstractly. And number B, use musical thinking. Number C, understanding conservative of matter. And number D, see the things from perspective of others. So correct answer is number B. So use the musical thinking. Why it is the answer? A 2 years old is expected only to use musical thinking, such as believing that a toy bear is a real bear. Sometimes they talk with their imaginary playing mate, right? So answer A, answer C, or D are not expected until the child is much older. Abstract thinking or conservative of matter and the ability to look at things from perspective to others are not the skill for small children like 2 years old. What we learn from here? We learn 2 years old children as a musical thinker. They like to thinking musically. Number 8, which of the following the best describe the language of a 24-month-old child? So languages and 24 months old means 2 years baby boy, how they talk. Number A, do not understand yes or no. Number B, understand the meaning of word. Number C, able to verbalize needs. And number D, ask why to the most statement. So correct answer is able to verbalize their feelings. So 24 months or 1 year, 2 years able to verbalize feelings. So children at 24 months can verbalize their feelings or needs. So A and B are incorrect because children at 24 months understand yes or no, but they do not understand the meaning of all words. So A and B is not an answer. And D, incorrect, and asking why comes later in developmental process, not 24 months of old. So number C is correct. Next question, a client who has been receiving the urokinase has a large body bowel movement. Which action would be the best for the nurse to take immediately? Number E, administer vitamin K intramuscular. Number B, stop the urokinase. Number C, reduce urokine and administer heparin. Number D, stop the urokinase and call the doctor. The correct answer is number D. Stop the urokinase and call the doctor. Right? So in examine, asking in this question, who has been receiving urokinase has a large body bowel movement. So this is the keyword, right? So which action should the best of the nurse to take immediately? We could stop the urokinase. Urokinase is a hemolytic used to destroy a clot following a myocardial infarction. If the client exhibits overt sign of bleeding, the nurse should stop the medication. And also, if the client, okay, and also call the doctor immediately and prepare for antidote, which is Emicar. Emicar is an antidote of urokinase. So number B is not correct because simply stopping of urokinase is not enough. And number D is stop plus call to the doctor. More information is here. We always choose the answer contain the more information. And number A or number, number C is not correct because simply stopping the urokinase is not enough. And also vitamin K is not the antidote of urokinase, right? So next question. A client has prescription for a calcium carbonate compound to neutralize the stomach acid. The nurse should assess the client for what? So you see, calcium carbonate compound we use for neutralize the stomach acid. The nurse should assessment the client for what? Number 1, constipation. Number B, hyperphosphatemia. Number C, hypomagnesemia. And number D, diarrhea. The correct answer is constipation, right? So the client taking calcium preparation will frequently chance to develop constipation. It is, we learn from here, calcium can cause constipation. We need to monitor my patient and allow them to eat enough fiber containing food and intake a lot of water, right? So number B, C or D is not correct answer for here. Not apply. So question 11, heparin has been ordered for a client with a pulmonary embolus. Which statement is made by the graduate nurse indicate lack of understanding of the medication? So heparin is an anticoagulant. We use here for pulmonary embolism to prevent the clot formation. So the new graduate doing something wrong, we need to correct them, right? So number 1, I will administer medication 1 or 2 inches away from the umbilicus, right? Number B, I will admit medication in the abdomen. And number C, I will check the PTT, means partial thromboplastin time before admitting the medication. And I will need to aspirate when I give heparin. So which statement is made by the graduate nurse indicate lack of understanding about the medication? The answer, the correct answer is C. Okay. Why C is the answer? C indicate a lack of understanding of the correct method of admin the heparin. Okay. And A, B, or D indicate understanding and are therefore incorrect the answer. I will check the PTT. It is not the correct answer for heparin particularly. And next question here. The nurse is caring for a client with a peripheral vascular disease. The correctly assessment the oxygen saturation level. The monitor may be placed where, right? Patient has a peripheral vascular disease. Now, you need to measurement the oxygen saturation level. We can monitor to place at the hip, ankle, or earlobe and chin. So the correct answer said the earlobe is the best option. Why? If we use the finger, if the finger cannot be used, the next best place to apply oxygen monitor at the earlobe. So you see, finger is not here. Out of 4, if the finger is there, we can choose the finger. So if the finger cannot be used or not in this 4 option, the next best place to apply oxygen monitor is the earlobe. So it can be placed. It can also be placed on the forehead, but chooses answer A, B, or D will not provide, right, reading. So it is not a good choice. Others only earlobe. Next question here. When caring for a client with hypertension, the nurse note the following vital sign. Blood pressure 140/20. Pulse 120. So you see blood pressure, systole and diastole is not normal, particularly diastole. Pulse rate is also not normal. It is 120, right? Respiratory rate 36, temperature 104 Fahrenheit. So vital sign is not stable. The nurse initiate action should be number A, call to the doctor. Number B, recheck the vital sign. Number C, obtaining arterial blood gases. And number D, obtain ECG, means EKG or ECG, electrocardiogram, to see the cardiac event in a graphical representations. Do we need it? So the nurse initiate action what? Number is call to the doctor, right? Because vital sign is not stable. So why number A is a correct answer? The client is exhibiting a wide pulse pressure. You see how gap between systole is 140 and diastole is 20. Huge gap. So it is emergencies, right? Also, patient has a tachycardia and tachypnea because pulse rate 120, respiratory rate 36. So the next action after obtaining this vital sign is to notify the doctor for additional water. So doctor may order arterial blood gas analysis for the next steps.